Hello students. Today we will discuss about the movements occurs at the shoulder joint. Now my dear students, whenever you are having the word shoulder joint, you have to keep in mind that we are talking about the joints which are taking place at the junction of your glenoid cavity and the head of humerus. Because you have one more question related to the shoulder, that is the movements occurs at the shoulder girdle. So the movements at the girdle are different and movements which are occurring at the joint are different. So what are the movements taking place at the shoulder joint? So these are the 7 varieties which occurs at the shoulder joint. So what these are? These are your flexion, extension, adduction and abduction, medial and lateral rotation, and the combination of these movements is known as circumduction. Now, the important thing to understand here in these joint movements that whenever you are talking about the planes of the movements, now in which plane these movements are taking place, here the movements are analyzed in the reference of body of the scapula. So this is the important thing, that if you are having the orientation of the placement of the scapula in your body, it becomes easy to check the movement, and these movements are not taking place with the reference of the planes of the trunk. Now this is important because our scapula is not straight, it is obliquely placed on your chest wall posteriorly. So let's see these movements one by one. First is flexion and extension. Now when you are having the flexion and extension, it occurs in the plane which is parallel to the surface of glenoid cavity, and it is right angle to the body of scapula. Now see, there are two things which you have to understand, that one, parallel to the surface of glenoid cavity. Now when you will have the glenoid cavity, it is facing not exactly laterally and forward, and the plane is parallel to this glenoid cavity, and this plane which is for the flexion extension is right angle to the body of scapula. So here in this diagram you can appreciate more clearly that this is your plane of scapula and this is your plane, or you can say the glenoid cavity placement. So now this is your glenoid cavity and your flexion extension will take place in the plane of glenoid cavity, and it is right angle to this plate, or you can say the body of the scapula. So here you have to understand this thing, whenever we are talking about the plane, it is in the reference of the scapula. This is your broader area on the lateral angle is the glenoid cavity. Now the flexion and extension occurs parallel to the glenoid cavity, and this flexion extension are taking place right angle to the scapular body or the plate of scapula. So when you will do the flexion, now flexion is when your arm moves forward, which is a normal definition of the flexion. But here the arm is moving forward and medially. Now why it is important to understand? Because you can do the flexion like this only, and you can do the flexion like this. Now what is the difference between the both flexion? Now this is possible because it is a ball and socket joint. So you can move the humerus in any direction. So the joint will never restrict your rotation at the shoulder joint. So if you are rotating the hand and you are doing this, it is permissible. But if you will see the anatomical placement of the scapula with the head of humerus, our scapula is not exactly laterally placed. It is following the curvature of the ribs. That's why it is placed like oblique plane. And because of this oblique plane of the scapula, your head of the shoulder is in the parallel part of the glenoid cavity, and it is right angle to the body of scapula. That's why it is going forward as well as medially. It is, if you are doing this exact forward movement, it is possible because it is a ball and socket joint where you are already have some lateral rotation and then you are doing the flexion. But from the neutral position of the humerus, if you will do, your hand will go like this. So this is forward and medially, that is the flexion, and it's reverse. That means when you are doing the flexion, your hand will come backward and little bit laterally. So this component is always there in the extension at shoulder joint. Now what is the axis? So my dear students, the axis for the flexion extension is transverse, and this transverse axis passes through the head of your humerus and glenoid cavity. So this is your axis, the axis is passing from here, and you are doing the flexion and extension around this axis. So your axis is the horizontal axis, and it is transversely placed around which you are able to do the flexion and extension. But you have to keep this thing in mind that flexion is not exactly forward, it is forward and medially, and the extension is backward and laterally. Clear? So now this is a superior view. If you will see from the superior side, you are able to see the proper understanding or the proper placement of the scapulas. Now here you can see that this is the curvature of your rib cage, and in this what you are able to understand that your scapula is following the curvature. It is not exactly facing laterally, it is laterally and forward. And because of this, your glenoid cavity comes here. The glenoid cavities are not placed exactly laterally here. So because of this reason, your flexion extensions are taking place in this plane, and this plane is parallel to the glenoid cavity. Clear? So here also this is the placement of the glenoid cavity. So parallel to the glenoid cavity, you will have the flexion which is forward and medially, and the extension which is backward and laterally. And this plane of the flexion extension which is parallel to the glenoid cavity is perpendicular, or you can say it is at right angle to the body of your scapula. Clear? And what is the axis? The axis is the transverse axis which is passing through the head as well as the glenoid cavity. So this is the important thing to understand when you are writing about the flexion extension at the shoulder joint. It is not exactly forward, it is forward and medially. Why? Because of this placement of the scapula which is not exactly laterally, it is faces forward. And why forward? Because it has to follow the curvature of your ribs. Clear? Now in this video clip, you will find this scapular placement more pronounced. Now here you can see that this is the curvature of the rib, and that curvature is followed by the scapula, and that's why you can see that the scapula is not exactly laterally, it is facing some lateral as well as forward direction. Now this forward direction of the scapula, if you will see here, allow this humerus to move in the plane of the glenoid cavity, and this plane is perpendicular to the body of your scapula. Clear? So my dear students, this is the important concept about the flexion and extension. Now we'll move to the muscles which are responsible these movements. So when you are talking about the flexion is caused by the muscles, those are placed on anterior aspect of shoulder joint. So one of the muscle is clavicular head of your pectoralis major and clavicular fibers of deltoid. So you know that these clavicular fibers of pectoralis major, when contract, they will pull the humerus anteriorly along with the clavicular fibers of the deltoid. But you have the short head of the biceps as well as the coracobrachialis. These are the weak flexors, they are not strong flexors. The strong flexors at the shoulder joint are your clavicular fibers of this deltoid muscle and the clavicular fibers of your pectoralis major muscle. Clear? Now, which muscle causes extension? Now, for the extension, you have muscles on the posterior side or the back so that these muscles can pull the humerus posteriorly. So, the muscle should have the origin from the posterior side and they should go on the anterior or the posterior aspect of your humerus. For example, here you can see the muscle which is more important, and that is the posterior fibers of the deltoid and latissimus dorsi. Now, if you will see the latissimus dorsi, it's a very broad muscle, and this broad muscle is going towards the humerus, and then it will come as a posterior axillary fold to insert on the bicipital groove. Now this muscle when contract, it will pull the humerus in the posterior direction, and these posterior fibers of the deltoid also pulls the humerus in the posterior direction. So posterior fibers of the deltoid and the latissimus dorsi are the chief extensors. And this extension is assisted by the teres major and the long head of your triceps. Clear? Now we'll talk about the two movements, abduction, adduction. Now when you will have the abduction, adduction, you have to understand about the plane in which it occurs. So this plane is midway. It is a midway between the sagittal plane and coronal plane. So what is the sagittal plane? This is the sagittal plane. This is the coronal plane. Now midway is somewhere here. So when I am doing the abduction, adduction, it is like this. Now again, you can do this abduction and adduction, but it is again not as per the anatomical placement of the scapula. Again, why you are able to do this? Because it is a ball and socket joint and it allows the rotation of humerus in any direction. But if you will have the neutral position of the humerus with the anatomical placement, you will find that your abduction and adduction is like this. Clear? And we have to do the flexion extension like this. So you will find that abduction and the flexion. So these planes are right angle to each other. Clear? So it occurs at the right angle to the plane of the flexion and extension. So what is the abduction and adduction? In abduction, adduction, you cannot go exact laterally at the shoulder joint. You have to go in a plane which is between the coronal and sagittal. Clear? So what is abduction? Arm moves anterolaterally. Now laterally is there, but along the laterally, it is going anteriorly. It is not exactly laterally, it is laterally plus anteriorly. So this is your abduction. Now here again when you will see this placement, now this is your flexion extension. Clear? Now this plane is adduction and abduction. Now you can see that this plane of adduction, abduction parallel to the body of scapula. And this is your, if you will see the sagittal and coronal plane, this is the sagittal plane, this is your coronal plane, and between this sagittal and coronal, you are having this plane for adduction and abduction, and this plane of adduction, abduction is exactly parallel to the body of scapula. Now this plane for the body of scapula, why? Because again you have to understand that scapulas are not exactly laterally, they are laterally and forward because they have to follow the curvature of the ribs, and in the plane of the scapula, in the plane of the body of scapula, you are having the abduction and adduction. So in abduction you are having the lateral movement, but not exactly laterally, laterally and forward. And when you are doing the adduction, your limb is coming medially, but not exactly medially, it is medially and backward. So this is the important thing to understand, that the axis occurs around the axis passing through the head of the humerus. So when the axis is passing through the head, you are doing these movement. This is abduction and this is adduction. So this abduction and adduction are taking place in a plane which is parallel to the body of scapula, and this is right angle to the flexion and extension. So what are the muscles responsible for adduction and abduction? So my dear students, when you are doing the adduction, now adduction is possible when you are pulling the abducted arm. So when the arm is abducted, the muscles which are connecting the humerus with the scapula and the anterior part of the chest, these muscles will pull the humerus towards the body. That is your adduction. So when the adduction is taking place, what is happening? That pectoralis major, which is forming the anterior axillary fold, and latissimus dorsi, which is forming the posterior axillary fold, both muscles are pulling the humerus towards the trunk or towards the midline of the body. And because of this pull, what will happen? Your humerus will come back towards the trunk, and that is responsible for the adduction. So what are the main muscles for the adduction? So main muscles for the adduction are the sternocostal fibers of the pectoralis major and latissimus dorsi. Now, it is also assisted by the teres major, coracobrachialis and biceps. So, coracobrachialis is a weak adductor and it is a weak flexor of your shoulder joint. It is a very important question for your exam that coracobrachialis is a adductor or abductor. So, here you have to understand that there are three compartments in the lower limb. If you will compare this with the lower limb, when you will go and see the thigh, in the thigh you will have the femur and there are three compartments. One compartment is here which is having the quadriceps femoris, medial compartment is having adductors and posterior compartment is having hamstring group of muscle. Now my dear students, now this adductor compartment of your thigh is having the corresponding part in upper limb is coracobrachialis. So here you can see that these medial compartment muscle are adductor and here the coracobrachialis is also a adductor. Clear? So it is a weak adductor and which are the powerful adductor? Pectoralis major and latissimus dorsi. Now what about abduction? Now there are three muscles or three parts of the abduction. In the abduction we are dividing the abduction into the three phases. One is initiation of abduction, that is 0 to first 15 degree, then up to the 90 degree and then 90 degree to further above up to the 120 and 180 degree. So dear students, you have a muscle which is on the upper part of the shoulder joint. Now this muscle which is present on the upper part of shoulder joint is known as supraspinatus. So when this supraspinatus contracts, so what will happen when the supraspinatus contract? Now this is your origin, this is the insertion point. And we know that when the muscle will contract, the origin pulls the insertion. So when the muscle will contract, this humerus will go like this. So it will move the humerus away. So as it will move the humerus away, it is known as initiation of abduction. So this is the supraspinatus muscle and this supraspinatus muscle is responsible for the initiation of abduction but only for the first 15 degree. So it is a very important muscle and it is known as prime mover for the abduction. Now after the 15 degree, the 15 to 90 degree, this part of the abduction carried by the middle fibers of the deltoid and that is known as acromial fibers. Now you have seen the arrangement of the deltoid that the fibers those are arising from this part of the acromial process are multipinnate. So you will have the septas which are present here and between the septas you will have large number of the fibers in the deltoid and this much of the multipinnate appearance of the deltoid make it more powerful muscle and that's why you are able to lift the weight of your upper limb and that is your up to 90 degree which is a action of the acromial or middle fibers of the deltoid which are multipinnate. Now above the 90 degree, that is known as overhead abduction, is possible by the contraction of the serratus anterior and trapezius. How? That we will see in the coming slide. So dear students, this is a very commonly asked question in your exam that why overhead abduction at shoulder joint associated with lateral rotation of scapula or forward rotation of scapula. So what do you mean by the lateral or forward rotation? That scapula is present on the posterior wall of the chest and there is a outward rotation. So inferior angle is moving in the anterior direction, that is known as forward rotation of the scapula. So why in overhead abduction you will have this forward rotation of scapula? So because when the greater tubercle of humerus impinges, now this word is important. What is happening that when you are doing the abduction, your greater tubercle hit your lateral border of the acromion process which is known as impinge. So the greater tubercle of humerus impinge on the under surface of the acromion process it produces the hindrance. So it is a kind of obstruction, and this obstruction avoids the further abduction by the humerus at shoulder joint. So because of this reason, now what will happen, that the movement of shoulder girdle will come in picture. So your scapula will move forward for the remaining further abduction, and it will show the lateral rotation. So for that, you can see this image here, which will make this more clear to us, that when you will have the abduction, now I have told you that up to the 15 degree you will have the supraspinatus, then up to the 90 degree you will have the deltoid muscle. Now once you will reach to this 90 degree, you are able to understand that this is the lateral, or you can say the greater tubercle of the humerus. Now this greater tubercle now hits this under surface of the acromion process, and because of this impinging, or it is a contact between the two bones, that is your greater tubercle of the humerus and under surface of acromion process. Now this humerus is no more going more laterally. So this hindrance or the obstruction, because of these bony surfaces are locking with each other, or there is a contact of this greater tubercle with the under surface of the acromion process. What will happen now, if you want to do more lateral movement of the humerus, what will happen, this scapula itself rotates. So this inferior angle will rotate and it will come here. So your humerus will go further up. So when you will take this like this, you are able to touch your ear with the medial surface of your humerus. That is your overhead abduction. So in this overhead abduction, what is happening, because of this problem, there is a bony features, and these bony points are creating the hindrance, because this lateral surface of the head of humerus hit the under surface of the acromion process, and this avoid the further abduction of your head of humerus in the glenoid cavity. So that's why now your scapula completely rotate, that is towards the anterior aspect, that is known as lateral rotation or the forward rotation of scapula. So here you have to keep this thing in mind, that when the forward rotation is taking place, that means when you need this inferior angle of scapula to move in the forward direction, what is happening, this is the trapezius and this is the serratus anterior. You know that serratus anterior insert on the ventral side on medial border of the scapula, and these are the upper fibers of trapezius. So these both muscle will pull in such a way that they are responsible to rotate the scapula. So dear students, here you have to keep this thing in mind, that overhead abduction at shoulder joint is possible by the muscles which are not rotating this. They are rotating the scapula. So here you can see the muscles which are inserting, or they are connecting the scapula with the trunk, not the humerus. Here you can see this is a connection of the midline with the scapula, and this is a connection of the chest wall with the scapula. So these muscles which are purely inserting on the scapula responsible for the overhead abduction at shoulder joint. But actually it is not the movement of shoulder joint, it is the movement of shoulder girdle which is allowing the movement of shoulder joint above the 90 degree. So you have this question so many times in exam that explain why the overhead abduction at shoulder joint associated with the forward or lateral rotation of scapula, or you may have the question associated with pectoral girdle movement. So you have to keep this thing in mind. The only important concept is this bony feature, that when you are doing this abduction, what is happening in the abduction, that this your bony point, that is the lateral tubercle, hits the under surface of your acromion process, and because of this reason no further movement of the humerus possible in the glenoid cavity. So to avoid that, what is happening, now the scapula itself start moving with the help of the contraction of the trapezius and serratus anterior, which will take your this humerus above the 90 degree, which is considered as a overhead abduction. Clear? So what are the muscles for the abduction? Initially you have the supraspinatus, then deltoid, and above this serratus anterior and trapezius, which moves the scapula, not the humerus. Now there is one more question related with the abduction, that you know that I told you supraspinatus is an initiator or prime mover for the abduction. So if there is an injury occurs in the tendon of supraspinatus, if the tendon of the supraspinatus get torn, then how abduction is possible? Then what the person will do? Suppose this tendon will get injured here. This connection with the humerus lost. Now you are not able to initiate the abduction. In this condition, how the abduction is possible? So there are two ways. One is, what will happen? Suppose this is my left side and my left supraspinatus muscle is not working, or my tendon of the supraspinatus injured, or it is torn. So what will happening? There are two ways. One is that I will move on the same side. Now I will move on the same side. So what will happen? Because of the gravity, you can see that automatically the 15-degree gap is there. And once there is a lateral flexion, it will create the 15-degree. Now this is followed by the action of deltoid. So this is the one way. Second way is that the person can passively move this my left side with the right hand up to the 15-degree, and then the function is taken by the deltoid. So prime mover of the abduction is middle fiber of the deltoid along with the supraspinatus. So they both are the prime mover. So these supraspinatus initiate the abduction, we know. So if the supraspinatus tendon will get torn, the abduction is impossible. You cannot initiate the abduction. So it can be done by the patient tilt the body towards the injured side. So I told you that suppose if my left side is injured, so I will do the lateral flexion on the left side itself. So what will happen? Automatically there is a gap of 15-degree occurs, and then the further abduction is possible by the action of the acromial fibers of deltoid. Now you will have the two sets of the rotation which occurs at the shoulder joint. So this is your lateral rotation and this is your medial rotation. So you can see that these rotations are taking place around a vertical axis, and these axis is again passing through the head of the humerus, but it is a vertical axis. Now which muscle causes the rotation? Now for the rotation you have to understand that muscle should insert on the anterior aspect of the joint. The muscles those are not inserting on the anterior aspect cannot do the rotation. So if you will see the deltoid anterior fiber, they are on the anterior aspect of the joint, so they are causing the rotation. Then you will have the pectoralis major, latissimus dorsi and teres major. Now see, these are the three muscles those attached on the bicipital groove. You have the lateral lip, floor and medial lip of bicipital groove, where you learn this mnemonic, lady between two major. So there are three muscles on the bicipital groove, latissimus dorsi in the floor, and two lips are having the pectoralis major and teres major. Now all these three muscles of bicipital groove are medial rotator of your humerus at shoulder joint. So when you are doing the medial rotation, all these three muscles of bicipital groove are medial rotator, along with the subscapularis, because it is also on the anterior aspect of the joint. So the muscles which are inserting on the anterior aspect of the joint are medial rotator. So the major muscles are the three muscles on the bicipital groove. So here on the bicipital lip you will have the three muscles. This is your teres major, here comes the latissimus dorsi in the floor, and on the lateral lip you will have pectoralis major. Now, which are the lateral rotator? For the lateral rotator, you need the muscles those are inserting on the posterior side of the humerus, not anterior side of the humerus. They should be on the posterior side of the humerus. So you know that teres minor. Now when you will have the teres minor, it insert in the lower part of the greater tubercle, which is on the posterior aspect. So here you can see that this is the lowermost part of the greater tubercle, which is receiving this muscle, is known as teres minor. While this infraspinatus is also inserting on the posterior side of the humerus behind the joint. So both these muscles when contract, what will happen? They will rotate your humerus outside. So that is a lateral rotation. So my dear students, here the question comes is that why the action of teres minor and teres major are different, though their origin is similar from the lateral border of scapula. So my dear students, the action of teres minor and major is different because the minor remain on the posterior side of the joint while major comes on the anterior aspect. So that's why when the pulling is taking place, the major is a medial rotator, and when the pulling is taking place at the minor, it is a lateral rotator. So you have to keep this thing in mind that teres minor is a lateral rotator at the shoulder joint, while teres major is a medial rotator because both are having the different point of insertion. One is on the anterior aspect of the bone and another is on the posterior aspect. Clear? Now, what is circumduction? So when you are making a combination of all these movements, you will make a cone-shaped triangle. You are making a cone-shaped structure in the space, and that is the combination of all flexion, extension, adduction, abduction. So that is your circumduction. Clear? Now, at the end of this session, you will have one more important point, and that is known as scapulohumeral rhythm. Now, dear students, earlier it is said that scapula moves only when you will have overhead abduction, and there is a pure movement occurs at the shoulder joint till 90 degree, and scapular movement come in picture only after 90 degree. But with the multiple experiments, it has been proved that scapula starts movement even though since you will start the abduction from 0 degree. So because you will have the role of the scapular movement initially from the 0 degree, there is a movement ratio between the movement at scapula and movement at shoulder joint by the humerus. So there is a scapulohumeral rhythm, and this scapulohumeral rhythm is a combination of abduction at glenohumeral joint as well as the forward rotation of scapula. So when you are reading the abduction at shoulder joint, you have to write down that abduction at shoulder joint is having the two component. Abduction occurs at the shoulder joint as well as there is simultaneously a forward rotation of scapula also initiate. And what is the ratio of these movement, which is known as scapulohumeral rhythm? Answer is there is a ratio of 2:1. Now what is the meaning of this ratio? That for every 2 degree abduction at shoulder joint, when the 2 degree movement is occurring at the shoulder joint, the 1 degree movement or the forward rotation of scapula is occurring. So this movement occurs at the shoulder girdle, and this is the movement of shoulder joint. So this is called as scapulohumeral rhythm, where there is a simultaneous movement is taking place by the humerus as well as scapula at the time of abduction, and the ratio is that every 2 degree movement of the shoulder joint associated with 1 degree movement of your forward rotation of scapula, which is termed as a scapulohumeral rhythm, and it is related with the abduction at shoulder joint. Clear? So at the end of this session of the movements at the shoulder joint, the first and most important thing which you have to keep in mind that the flexion, extension and adduction, abduction, they are parallel to each, the planes are right angle to each other, but the important thing is that they are in the reference of scapula, and you have to keep this thing in mind that our scapula is not placed exactly laterally, it is following the curvature of the ribs, so it is laterally and forward, and that's why in anatomical position the flexion component is having forward and medial component, and in the same way the abduction is having your lateral but anterior component. Clear? So this is the important concepts about your different movements at the shoulder joint. So this is all for the session. Thank you.